So I just want to start with a quick disclaimer saying that you don't need to buy any of these things to do well in dental school. They're kind of just like a nice to have, make your life a little bit easier, but you can definitely pass and do very well in dental school without them. They just make your life a little bit easier and make it easier to sometimes study and stuff like that. Also, another thing is that I would wait until I start university before I decide to make any of these things, or like some of these things. Like for example, a skull. Why would you buy that if you don't know how important anatomy is in your university? For most dental schools, anatomy will be very important for the head and neck. At least you'll need to know all of like the bones and like the foramen for which nerves go through where and which they innervate. You need to figure out what your university like focuses on and when they focus it on, and usually this is in the first few years. But yeah, so these are just some things that I thought would be really helpful for you in dental school, and that has really helped me. Might as well start with the skull because we talked about it already. It's really helpful to basically like, you'll be able to label on them which is the zygomatic bone and which is the XYZ, and which nerves go through which holes and what parts they innervate, because that's something that you still need to know to this day. Is like, you know, for example, if there's a complication on this side of like the parotid or something like that, what nerve is it affecting, what teeth are close to which nerves, and you know, extractions and complications and stuff like that. So yeah, so it's really important to basically know your anatomy, and a lot of universities will focus on this and there might be exams on this, so this might be something that's helpful. It's only like £10 on Amazon, and I gave mine away to the people in the years below me because I don't need it anymore, but it was really helpful back in the day. So the next thing that kind of changed my life completely, like literally completely, is this Filofax notebook. That is basically for my clinical stuff, and it's really like life-changing because they have like the little binder stuff in the middle. So when I want to take out a page, I can literally just like lift it up and take it out like that, like this. And that's really life-changing because, for example, in here I will have every single target that I need to achieve, every single criteria for the targets I need to achieve, every single like treatment plan that I can do. So for example, like a root canal, and then I will have a list of all the instruments that I need. So when I have a new nurse or something like that, I can just rip out that page or like take it out the page and then give it to them and be like, okay, get every single thing on this list, and then give the page back to me, and then I can put it straight back in. I also have loads of things on like the treatment. So for example, if I was doing that root canal treatment, I'd need to know the anatomy of the different teeth, or if I'm doing extraction, I need to know which forceps to use in which, and which movements I need to do and stuff like that. So it's really helpful, and it's literally saved me so much. And I will be doing a flip through soon. I will have 2 videos on like my patient diary and how I organize patients, and then also how I organize this clinical diary. So make sure you subscribe because you don't want to miss that video. Yeah, but that'll be coming out soon. And another thing that's really helpful is that they have like these little well, I bought these dividers, and they're really helpful because on each one I can separate them. So one will be perio, one will be ortho, one will be endo and stuff like that, and I can separate them from speciality, and then I know exactly how to find my treatment planning and stuff like that. It's really helpful, and it's been life-changing, and it wasn't even that expensive, and getting the inserts are so cheap. And this is not like the actual Filofax one, this is just a A5 non-branded one, which has changed my life, honestly. I know I'm really passionate about that, but like, for example, if I'm given an emergency patient, I'm never worried because I know exactly what to do, what the different diagnoses I can give, and what special investigations I have to do, you know, all of that stuff. I know what to do because I have that notebook. So textbooks is another thing that I think every dental student should have. It's a very comprehensive way of getting information about things. In dentistry, there are only like a certain amount of things that you need to know, really. So, you know, when you have a textbook that's very detailed into the different types of like oral cancers and, you know, cysts and stuff like that, it's very helpful. And the thing is though, I don't recommend that a lot of people buy them. I think you can get like a PDF version, or you can get a laptop version. You can even get one that comes up on your phone that can be really helpful, and so I recommend getting those PDF versions first. And I will leave a link in the description that will basically take you to a website that pretty much has most textbooks on it if you just type in the name, and you can download a PDF of it for free. But one textbook that I do think you should get is this one. Now this is the Oxford Handbook of Clinical Dentistry. It's the 7th edition. I think this only came out last year. It's really good. It has some photos in it. A lot of people are very controversial about this because, to be honest, like it goes through like, how can you fit the whole of dentistry in this book? I get it, but it's like a very good like overview of everything that you need to know. It kind of goes through every single thing that you need to know, not in that much depth, but it goes through like the important things. And I think this is really helpful because when you're in clinics, and if you need to look up something like really quickly, you can look it up. And the thing is, on clinics, you're not allowed your phones or anything like that, so this is where this would come in really handy. Or if you're on the bus and you want to quickly read something, it's got a lot of clinical knowledge, and that's why I love it. And following on from that, an iPad is something that is so helpful for a lot of dental students, but not every single dental student. I think this is one of those purchases that you should wait until you start university before getting, because, you know, know, it's a very expensive like purchase, but I really love my iPad. I use it all the time. I used to use it a lot for like when I'm in lectures, I just like annotate and stuff like that. It saves you from printing. Obviously you don't need to like note take through all your lectures, but it helps with like making questions and figuring out what areas I don't know. It's really good as well for like textbooks because I can annotate, highlight, all of that stuff. I love doing that when I don't understand a topic. Obviously those are not effective studying strategies, but I will have a video all about how I learn content and how I effectively study coming soon, you know, all about my spreadsheets and stuff like that, and how I organize them in Anki and stuff like that. But yeah, I do think that the iPad is really helpful. It saved me a lot of time in my earlier years because all of the information from the exams were directly from the lectures, so if I didn't go to lectures it would kind of be a waste of time. But I think that's when it was like most helpful. Now I use it for like a load of other things, but it's still really helpful, and I've had this for years and it's a really good investment. But also just kind of figure out what your university, like how do they have their exams, what are their style, is it like pre-recorded lectures, is it Zoom, is it like in person, all of that stuff, and figure out if an iPad is actually going to be useful for you. But yeah, I think checking that out is also good because I know like most medical students, most dental students also have them. I think also like universities are now like having iPads in university that they lend out and stuff like that, so maybe you can use those and that would be helpful too. It just has to fit your learning style and then you can decide if you want to invest or not in it. Now the next thing I think you should invest in is a good pair of clinical shoes. Now for us at least, we have like some criteria, like it has to be closed shoe and it has to be wipeable and it has to be black. So those are the criteria, and I think getting a pair of comfortable shoes is so important because basically you're going to be standing in them all day. And my brother's a doctor and we actually got our shoes together and he got me this pair, but he said that you basically, you know, you live in your shoes. You're basically, you're part, like as in like you're literally working in your shoes all day and night, and you're most likely standing for most of it, you know, presenting to your supervisor or like talking to your patient, and like very rarely are you sitting down apart from the actual treatment part. Like you're actually like running around, you're getting materials, all that stuff. So you want to make sure that you're comfortable, and these ones are from Crocs. But I know that, to be honest, I might be changing to Crocs soon because I know that they're so comfortable. A lot of dentists actually wear Crocs and I think they're coming back anyways. If you can get like a nice pair of black ones, apparently they're really comfortable. So yeah, try and get comfortable shoes, you know, at the start of the year as well. That's really important, and that is something that you should definitely invest in because, you know, your posture, all of that stuff is very important. And following on from that, a lot of people get loops. So loops, basically they kind of give you like a magnification power, so a lot of the times you'll be struggling to see. And I don't know if you've ever like already started seeing patients or anything like that, but like it's very easy to kind of just like ruin your posture and like be looking down all the time. Your neck's gonna hurt. 9 out of 10 dentists have back problems, so you know, it's something that you need to be careful of. It really just helps you with your posture and keeps you like in that upright position, and a lot of people say that it helps them, especially with like endo and stuff like that, but they are very expensive. So once you start dental school, you will get like a discount code that you probably can use that will be really helpful. And you know, at that point you can ask other people, okay, which ones are the best loops, because there's so many different types and they're all saying they're the best. You can get them also at different magnifications and stuff like that, so you kind of want to wait a bit before you get loops, because for example you get for Bryant loops you have 3.8 magnification, 5.7 and 7.2 for Bryant loops. And the thing is, you want to figure out what kind of like thing you're going to be working on. So if you're a general practitioner, you can get the one that basically you can see like a quadrant, and then you can get ones that you can only see one tooth, and then you know, you can get different types of magnifications for different needs. And you know, if you want to do more restorative, or if you want to do more endo, if you want to be a GP general practitioner for most of your career, then you can get those loops according. And you can also actually get variable focus length loops, I think now, but the thing is with those, they're very heavy. You have to be thinking, especially in these COVID days, you're going to be having all this PPE on and stuff like that, so you kind of have to weigh up what you want and you know, what versatility you want. And another kind of like digital kind of thing is you want to get a really good camera. Now you don't have to get this at the start, but I think it's very important eventually, like even like when you graduate, that is something that would be top priority, because nowadays, you know, even if you're not on social media, like a lot of people, a lot of dentists, like even like after you like go from NHS, if you want to go to private, you want to have your own patient list, because otherwise you might be losing money. So you want to have a social media presence, and like honestly, this will just help you even with getting jobs. It's more likely that you're going to be chosen, get a better job with better UDA targets and stuff like that, and get more private practice work and all of that. And you just basically get better at your practice. You take photos of your patient's teeth and you get good at, you know, lighting and taking the right shots, and you know, there's different types of shots, buckle shots and all of that stuff, and you get good at basically showing your work to other people. But also, like, it's not just that, it's like you get really good at showing it to your patient. Like, for example, it's in their mouth, they don't know how their teeth look, they don't know what caries is and what decay is, so you want to show them, okay, so this is the tooth that we're worried about, and this is why, and this is the treatment options, what is it up to you, and stuff like that. And they have a better idea of what you're seeing because, you know, they can't see what you're seeing. And so I think getting a good camera is very important, but also not just that, I think getting the lighting, you can get like twin flashes. There are whole courses that you can go on for dental photography. It's just such an important thing in your dental career, and I know that it's just moving towards going more social media nowadays. That's how you get your patient list and stuff like that. There are like a lot of things like dentistry related that you can get. Like, for example, if you're struggling with composite and, you know, composite restorations, you can buy like kits at home that will let you carve out teeth and do a composite restoration, give you like a little UV like torch to help you cure it at home, and like carving these things, doing like polymer clay. And you can get like courses as well that you can do that will show you how to do better composites. A lot of these things you can't practice at home, but for example, I know that in, I think it was my second year or third year, a lot of people, like I think half of my year, failed these composite like exam, and it got very scary because, you know, people can very easily fail the year and have to redo the year if they fail this exam one more time. And I think a lot of people bought those composite kits and, you know, practice it at home and stuff like that. That's really helpful. Obviously, you know, it helps if you have money, but yeah, those are just options. Those are things that you can do if you're not so confident, or if you have a patient coming up and you want to practice. Those are things you can do. I think they run around like £100. I think once you're a dentist or a foundation dentist, you'll be doing a lot of courses, a lot of study days, so you will get the practice that you need, and this is just something that's supplementary. Another thing that is actually really cheap is just getting like a set of mouth models. So I know that like in dental school you probably have like those typhodonts, which are basically like fake teeth, but you can probably get those from Amazon as well. And like, you'd be thinking, okay, why do I need this? But it might be really helpful to, for example, like position, like to practice positioning for the maxillary teeth or like the upper teeth, and like practicing using the mirror, practice using the probe. That might be really helpful. So the next thing I think is so useful, and that is this thing. Now you might be thinking, what the hell is this? It's actually made for hijab wearers, basically for like tying up your mask. So what it does is you hook the mask onto these ends, and then it kind of like sits on your head instead of like hooking around your ears. And the great thing about this is if you wear glasses, or if you wear loops, or even if you just have like the visor, everyone has to wear a visor, it can really like weigh down on your ears. And I started getting headaches at the start of COVID because you're wearing a lot more PPE and you're wearing a mask all day, and my ears were just throbbing and it was hurting so much, and like it gave me a migraine. So when I switched to these, they're literally so like loose on my head, and it feels like so great because it feels like I'm not even wearing it, but obviously it's protecting me and it's protecting the patient. Yeah, they're really good. I'm not sure exactly where you can find them. You can probably knit one yourself. It's just like even if you get like a ribbon and put 2 buttons on it, that can be really helpful. Probably you can get them online, to be honest, at this point. So basically, if I have a mask here, if you hook one end around this and then you pull it back like this, and then you tie it over here, and then it just kind of like stays there, and it's really like helpful, and it kind of just stays like that, and the actual thing is all the way at the back of my head, and it's not like hurting me or anything like that. So yeah, that's really helpful. And yeah, you can get like shorter ones and longer ones depending on how like loose you want it. But yeah, that's all from me. I hope that was really helpful, but I do want to reiterate that you don't need any of these things to become successful in dental school. I think there are a lot more important factors, but these are just some things that help when you're, you know, in clinics and stuff like that. But yeah, make sure you check out all of the other videos on my channel, because I have so many videos about getting into dental school, as well as life of a dental student, because I'm now a 4th year, and productivity tips. So if those are things that you're interested in, make sure you check out those videos and subscribe so you don't miss another video like this, and comment because I reply to every single one of them. And yeah, I'll see you later. Bye.